So before I introduce our next speaker, I just wanted to highlight and put in context that I think today what you've heard is that your road to a more fulfilling recovery is getting that right team of healthcare professionals together that are going to listen to you and to work with you. And by coming to our conference, we've given you more information about the disease and the modalities for treatment, and so you can go in more intelligently as a partner with those team members. So with that, I'd like to introduce Dr. Jill Harrison, who has a doctorate in acupuncture and oriental medicine. Dr. Harrison is an acupuncturist and herbalist practicing in Los Angeles. She is the founder and president of Joyful Life Healing, a Chinese medical practice that consciously invites and guides the individual through a journey toward wholeness in body, mind, and spirit. Jill holds a master's degree in traditional Chinese medicine from Yosan University and a doctorate in acupuncture and oriental medicine from Pacific College of Oriental Medicine. Jill has a BA from Ithaca College in Comparative Religious Studies and Philosophy, an MA in Developmental Psychology from Pacific Oaks College, and an MS and her DAOM from Pacific College of Oriental Medicine. Jill has had a daily meditation practice for 20 years and coaches her patients and other clients in learning to meditate, as well as the importance of a meditation practice in one's life. And boy, do I swear by that. So with that, I welcome Jill Harrison. Thank you.
Hi, everybody. I'm going to try to work with a microphone because then you'll be able to hear me. I am Dr. Jill Harrison, and I'm very pleased to be here. Thank you so much for inviting me, Dominic. And that was a great introduction. I need my glasses because I'm 45 years old, and I don't read well without them anymore. You know, everybody, but I can't see. I also have good vision, so it's only about reading, so I need bifocals or something. Anyway, it's true what everybody was saying about there's not that much research there. So what I'm going to speak to you about is my clinical experience and anecdotal experience. But first I want to share with you a little bit about my favorite topic, which is Chinese medicine. And she said everything I was going to say, that I'm a licensed acupuncturist and herbalist. I've been doing this for over 12 years now. I also have a master's in developmental psychology, and I was a psychotherapist for 7 years before going into this medicine. I'll tell you a little story, actually, real quick. I worked at Children's Hospital of Los Angeles in the Division of Adolescent Medicine for 7 years, and I was working in a team treatment setting, and a lot of the doctors were talking about having a team. So in this hospital, we were a team, and I did the mental health aspect, and I was along with all the other, people always say, you know, how did you become an acupuncturist? How did that happen? And how it happened was I was there and I was working with residents and interns and physicians, and when they would test the residents and interns about what was happening medically, I would always, it was like my Jeopardy. I would always answer the question, and I had no idea how I knew the answer, but it was pretty much always right on, and it was just an intuition. And I was 26 at the time, and two people came up to me, the heads of my department, and they said, we really want to, first I thought I was in trouble, because they were like, we want to talk to you, and I thought I was in trouble. But then they said, we really want to encourage you to go to medical school. And I was actually, first thing, very flattered, because I was never like a great math and science student or anything like that. And to have these people who were my mentors and great leaders in the medical community say you should go to medical school, it was very flattering. On the other hand, I didn't really want to write a prescription for somebody or cut something out. I wanted to find out what the root cause, what was causing something, what was, and more than that, prevention. You know, how to keep people healthy so they didn't get sick. In fact, in ancient China, your doctor did not get paid if you were sick, because it was their job to keep you well. So that's kind of where we're coming from in this. But living in the United States and living with the toxicity that we do and all the stressors we have, we don't have that opportunity. So sometimes we have to come in and deal with what's going on. So let's see what I wrote. Okay. Patients ask me, how acupuncture works. And I explain it to them the best I can, but what I do say is that sometimes it feels like magic. I don't always know how it works, but I know that my patients come in and they feel better when they leave. And they come in hobbling sometimes, and I have treated peripheral neuropathy quite a bit. I was volunteering in a clinic, an HIV clinic, for a long time, and a lot of the HIV guys and women had peripheral neuropathy, so I treated that a lot on a volunteer basis. In terms of my own patient load as a licensed professional, probably treated about 25 cases, and honestly, 85 to 90% success, but not everybody. But a lot, a lot of success, not perfect, but improved, and some people actually got better, which was a miracle. And again, I don't know how it works. And I don't need to know how, because people are walking away and they're feeling better, so that's kind of all I need to know. And there is research. There's Western medical science that's being done now on acupuncture and herbal medicine. Mayo Clinic and the Cleveland Clinic are incorporating Chinese medicine, acupuncture, and herbs there, and that's pretty great standard to have. First let me ask, how many people have tried acupuncture in this room? Quite a few of you. Okay. Did you enjoy it? You didn't like it? You didn't like it? Anybody enjoy it? Okay, so we got, oh, you brought your acupuncturist, hello. So probably some people didn't have a good experience, and it looks like quite a few of you did have a good experience. Yeah, and when it doesn't help, it really is frustrating, because you're like, I'm trying this, the stranger's sticking needles into me, and I'm leaving and I don't feel good, and I don't even feel better. One of the things, being a psychotherapist before becoming an acupuncturist, I intuitively felt that if the mind was out of whack, the body was going to be out of whack. So actually, in one of our more ancient texts, about 2,000 years old, in the Neijing, Huangdi Neijing, it says, if you first have to treat the spirit before you treat the body. And we talk about it in terms of root and branch. You treat the root cause before you treat the symptoms. We go for the bottom up, from the bottom up. And with peripheral neuropathy, there's so many different root causes. Everybody's an individual, and we treat, I treat the individual, so instead of the disease. This medicine is ancient and sometimes very poetic, and it's certainly philosophic. And when I talk about it, I'll do my best to be clear, but if I explain it solely through the lexicon of Western medicine, it doesn't quite translate. So I'm going to use words and... Is that me? Oh, okay. That's cool. Oh, we can help you with that. No, I'm glad to take a break. I told you why I did this. And okay, so in terms of Chinese medicine, there's a lot of modalities. One is the needles, acupuncture, herbal medicine, Tai Chi, Qigong, which is movement, martial arts, nutrition, meditation, massage. We have different types of acupuncture where we use, and this is used a lot with peripheral neuropathy. It's called a 7-star needle, and I brought one for show and tell, but it's really small, so after, if you want to see it, I'll show you. And it's like a hammer, and it has 7 different needles on it, and you pop, 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 pop. You do it on the areas where there's pain and nerve damage, and it kind of brings chi, energy, blood flow to the area. Can be a little painful, but you get used to it. But the regular needles that we use are not painful at all, at least most of my experience. Let's see, how does it work? Like I said before, we treat the individual, not the disease. We try to get to the root of the problem, and we believe in our medicine, we believe if you only treat the symptoms, you'll only get temporary relief. But if you treat what's underlying, the whole person, then you're more likely to get long-term. And like I said, I'm grateful that the doctor before me spoke about depression, anxiety, and stress, because one of the things that I do before I do anything is I treat the stress. You know, it really helps. If you get a good night's sleep, acupuncture is great for sleep. It's great for nutrition. It's great for energy. You know, it's definitely good for moving the blood flow and interrupting and helping to interrupt the pain from neuropathy, but it just brings the body into so much more of a balanced place. Let's see. You know, I want to talk a little bit. The first thing I tell my patients when they come into my office is that I believe that the body is a healing machine and that many things can get in the way of the body's healing itself, and it's my job to figure out with you in partnership. Like, that's the second thing I say, is that you and I are partners. I am the expert in this medicine and you are the expert of you, and together we can be like Holmes and Watson and kind of figure out what the different layers are of your, you know, of what's going on for the individual, for you. But what I tell my patients is that their body is a healing machine, and that many things, stress and injury and all kinds of things, allergies, get in the way of the body healing itself, environment, many things. And like I said, it's our job to figure that out together, because when we get, and I'm quoting the gentleman before me, if we get our body to a place of being rebooted and in a place of healing itself, that's actually the secret that I always tell my patients, is that it makes me look really good when you get better, but really it's your body doing the healing that's much more powerful than anything I can do. And this is just my opinion, but any outside drug or intervention, in my opinion, nothing will heal you better than you. So if your own body's intelligent capacity to heal itself. So if I can get in there and help with the stress, if I can get in there and help with the sleep and the pain, then I think the body, in my experience, and like I said, anecdotally and clinically, it's my experience that people do get better. So I don't need to go into, you know, the diseases associated with peripheral neuropathy. Of course, when I came here, I didn't know what my audience was, but you guys have been talking about that all day. So I'm going to just talk a little bit about this medicine and how it works. In Chinese medicine, peripheral neuropathy can be viewed in many different ways. Qi and blood stagnation. Qi, loosely defined as the energy of the body, and blood, stasis or stagnation, the blood not moving well through the body. Damp accumulation, or here's a good one, kidney yin or yang deficiency. And that's kind of the energy of the kidneys. Now, in Chinese medicine, when we talk about the organs in the body, we're not talking about the tissues, the organ tissue, the heart, the kidney. We're talking about the energetic function of each organ. So when I talk about kidney yin or yang deficiency, I'm talking about the function of the kidney as opposed to the organ itself. That's like me explaining little things for you. In peripheral neuropathy, often both excess and deficiency exist. So what we want to do is we want to move where there's excess or stagnation, this using the needles and herbs, and we want to nourish or boost where there is deficiency. That kind of creates the homeostasis in the body where, again, the homeostasis is the place where the healing can occur. Let's see. I don't want to repeat myself too much because that's boring. So, how Chinese medicine can treat neuropathy is, there's dampness and blood stagnation moving into the limbs, which obstructs the flow of qi, or the energy in the body, and the blood that moves with the energy. So the treatment is twofold. We first treat the underlying factor that's causing the dampness and the blood stagnation to accumulate, and then we directly facilitate the circulation of the energy in the blood in the affected area. By improving the circulation, the nerve tissues of the affected area can be nourished to repair the nerve functions and reduce the pain. So that's sort of the system by which it works in a simple way. Since so many of you have been to an acupuncturist, I'm not going to talk to you about what happens when you go to the acupuncturist. It's not a 4-hour interview like a homeopathic. It's more like first session's an hour and a half, and the follow-ups are about 45 to 60 minutes, because you're laying there and relaxing and going into this wonderful place. It's very relaxing for most of my patients. And we can talk a little bit later about it. And, you know, I think I've kind of covered everything I really want to cover, telling you where the points are. Again, I didn't know if we were round table or how it was. It's not going to help. It's in the extremities and in the mid and in the trunk in the midsection, and based on, so somebody comes to me for peripheral neuropathy, and the next person comes with the same exact symptoms. Most likely, I'm going to treat them completely differently because your constitution, your medical history, and what we call Chinese medical patterns are all going to be different because you're different people, you're individuals. Same thing for migraines. When people come in for migraines, I don't treat them the same. I treat them completely differently based on what their constitution is, what their medical history is, and that's basically it. I think content-wise, I've covered everything I wanted to cover. I'm so happy to answer any questions that anybody has. If you have any questions. Yes, sir.
Yeah, how come some acupuncturists put more needles in you than others?
You know, it's a good question. It depends on, you know, what you're treating, of course. Oh, he said, the question was, why do some acupuncturists put more needles in than other acupuncturists? And there's this thing called an elegant treatment. An elegant treatment is when you know where the channels, the meridians of energy intersect, and you don't have to put that many needles along the channel to make it work. That's good. With pain and stagnation, though, sometimes you want to have a lot of stimulation and a lot of needles to move the stuck chi. So it depends, you know. If somebody's very elderly, I will not put as many needles in. If somebody is strong and has a lot of like stuckness and stagnation, I'm more likely to put more needles in. You know, if somebody's weaker, I'll put less needles in and I'll retain the needles for less time. If somebody is much stronger, then I will leave the needles in for a longer time. It really depends. And how you manipulate the needles depends on the individual. It's like all different for every person. Is there any other questions? Any question is fine, by the way. Okay, sounds good.
Thank you very much.
You.